April 8th, the time being 5 o'clock. We will start. Will everybody please stand for the Pledge of Allegiance?
Okay.
I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
Please be seated.
All right, and we're going to start with public announcements, and I will pass the baton over to Chris for the announcements from the Health Division of the Inspectional Services Department.
A couple announcements. First of all, good news, the compost site is back open again. Saturdays 9 to 2. We're fully staffed for the year, so I anticipate that, excluding weather events, the compost site should be open. We continue to take yard waste, mattresses for a fee. You can drop off scrap metal, electronics we take for a small fee, and that fee schedule is available on the town website or by calling the health department, at least for the next 3 weeks. Which leads me to the other announcement. So on Monday, I tendered my resignation to the town manager. My last day here will be May 1st.
We are all very disheartened and disappointed to hear this news. Happy for you, of course, but very sad to see your departure. You are amazing in your role.
Well,
You've established great connections with the town. So this is truly a sad, sad time.
Yeah, it is a tough decision. I'm very much invested in this town. I love this is a fantastic board. You guys are obviously very dedicated to public health. I wish the town shared your feelings about public health. It does not, so.
I know. Hopefully, we are going to strengthen some of those bonds and get people on board.
Excellent.
We'll have the next 3 weeks to thank you many more times over.
That's right.
Lay it on.
Prepare yourself, we're going to butter you. How were you able to get all of the volunteers for the compost site? It's been such a struggle for the past many years.
So it's, we have 2 Johns now. They just really like working there.
Amazing.
They
Thank you,
actually
John and John.
went so far as to strip apart all the broken trash barrels that are up there so that we can hopefully get them recycled. So
Wow.
they just came in and they grabbed the schedule and all the way through, so.
Awesome.
So just
Saturdays,
Saturdays,
9
to 2.
Saturdays 9 to 2, yeah.
Beautiful. Anything else?
That's it from me.
Thank you, and no thank you for your resignation, but I guess I have to take it. All right, so we'll move on to our discussion and action items. The first is a vote to approve the meeting minutes from March 25th, 2026. Do I have a motion?
I'll make a motion to pass the meeting minutes of March 25th.
I'll second it.
I thought that I had something that I disagreed with here.
Do tell.
Discussion.
Yeah, as soon as I can't find it quickly, I'll just, you got, it'll pass, so.
Are you sure?
Yeah, I would think it was a small thing, but yeah.
Okay.
Yeah.
Well, if it
I
comes
looked
up,
at
I'm
it this
happy to make
afternoon,
edits.
yeah. I just can't find it quickly right now. I've had
Okay.
a lot of things going on since the last time I looked at it.
Yeah, no pressure, no pressure. If
Thanks.
something pops up, we can always,
If something does, I think it
Yeah.
was just like a small, this
I
one
make a
didn't say
typo?
that. I read, yeah, a little small thing, yeah.
Okay.
But it changed the meaning a little bit, but yeah, it's fine,
well, we're okay with it.
yeah.
All right, so I've got a motion from Caroline, a second from Lisa. Thank you. All in favor?
Aye.
Aye. And then we will move on to number 2, which is our health agent report.
Nothing to write in this week. Didn't have any major inspections. Got a couple of complaints about a abandoned pool on Monroe Street. Interesting fact, so I investigate any complaints that we get. A lot of them don't warrant any further action, but I have to investigate any that are made. So a couple of people complained about a house on Monroe with an abandoned pool. I can only look into it, I can't go on somebody's property without their permission, which is something people apparently didn't understand during our discussions on animal regulations. I can only use what's called the Fairview Doctrine, so what I can see from the street. The property in question has a stockade fence. I can't see anything from the street, so I don't know what the condition of the pool is in the backyard, but.
Is the house abandoned as well, or just the
Nope,
pool?
there's people living there.
Okay.
I mean, there's a couple of places around, it's hard times, people can't afford to fill their pool. I would ask anybody that's considering abandoning their pool, that they get a cover for it. speak to Plymouth County Mosquito Control. There apparently are some larvicides that you can add to stagnant water in your pool to keep the mosquitoes from growing, but it's a stagnant body of water in your backyard is a huge health hazard. And it's a public health hazard, so we can take action if it's not addressed. So just ask people to please be responsible with their pools.
Did they identify, is it above ground or?
It's below.
Yeah,
I've asked the complainants if they can take pictures from, if they can see it from their yard. I can act on that, but I can't see
Yeah,
anything from the street.
So there's, lots of health hazards, but they have a stockade fence, so that prevents at least, kids from falling into an empty.
Yeah, and I think there's probably zoning regulations around that. Only other thing to report, I haven't had any trainings the last few weeks. I was on WBZ Radio getting interviewed about the poppy seed tick post on Facebook.
I saw the post.
That's fun.
Yeah. We posted that before without comment from the public, and apparently this year, both the Enterprise and WBZ picked up on it. Excellent opportunity to educate people about ticks and alpha-gal syndrome, so it was worthwhile. But just to reiterate, ticks are not attracted to food, and there's no restaurant serving ticks on their food.
And poppy seeds don't have
Because it
ticks.
looks like a
Yeah.
box.
Yes, and that was the whole idea of the post, was to show you how difficult it is to
How
identify
small they are.
nymph ticks. Yeah.
The number of tick-borne illnesses is just on the rise as the kind of range and behavior of ticks keeps growing, going more and more northward over time. So I think we all have to be very cognizant. So thank you for posting all of the prevention activities that people can take for tick control and checking their themselves, tick checks, and their pets. If their pets are out wandering around ticks are endemic to our region. There's no avoiding them. But the diseases that they're carrying are numerous. And I think, we'll probably be continuing this discussion through the season. Because in the past, deep freezes for extended periods of time would kind of keep ticks away. But they don't ever go away anymore because we have cold and then we have hot and then we have cold and then we have hot, right?
Yeah. Mass DPH has just added alpha-gal as a reportable disease now.
Oh,
so
good, that's great.
That will get reported through Maven if there's any confirmed cases.
Alpha-gal is not good, not great.
No, and that's, the symptoms from that can show up to a week after you consume whatever product. And people think it's a meat allergy. It's an animal protein allergy. So actually medications and cosmetics can also cause a reaction. And the first symptom can be anaphylactic shock. So it's pretty serious stuff, yeah.
Yeah.
They have programs where they come in. We've done it before and had them on Abington Cam. If you think that that's something that the public would benefit from, if we think that's something that the public would benefit from. They come in, they talk a lot about ticks and what you can spray on your clothes and what to stay away from and such. If you think there's benefit to that, then that's an easy thing to arrange.
There's, lots of really great educational.
And it's
There's lots of great free educational materials out there, and it's just, kind of working with kids and making sure that their parents are aware, and, and then like the community, we have Island Grove, and I think that gets sprayed pretty well for most insects, but we also have a state park where hiking is really quite popular, and I know for personal experience, there's plenty of ticks there, and alpha-gal doesn't show up like Lyme, for example, with a bite that has kind of telltale signs. It's really hard, and most people don't get tested for alpha-gal. So, just another thing to be aware of as the weather gets warmer, and it will.
Thank you, Chris. Thank you, everybody. Our third discussion and action item is the discussion regarding a proposed regulation prohibiting the manufacture, sale, and distribution of kratom products, synthetically derived cannabinoids, and unregulated novel intoxicants. So we had kind of started talking about this at last meeting, decided that we were all in favor of kind of proceeding forward and implementing a regulation for Abington, because it's not at a state level yet. Are we still feeling all in favor of that?
I think in our packet here, we have just a fact sheet about, just reminding us why we're talking about kratom, because people are probably still asking, what is it? And why is it a problem? And then we also reached out to, actually Melissa Cook helped us reach out to the town of Canton, who implemented some regulations already. And then we also, Chris and I attended a webinar that also discussed, well, the people from Canton were there, as were the people from Northampton. The big difference between the regulation proposed by Canton and the one from Northampton is that Canton was just kratom, and Northampton is the one that Katie just so artfully said, the big long one about manufacture, sale, and distribution of kratom products, synthetically derived cannabinoids, and unregulated novel intoxicants. And I feel very strongly that that's the way to go, because kratom is one kind of product.
Right, let's encompass it all under one umbrella.
Right, and it's this kind of synthetic concentration is a chemical process that is making it much more dangerous than the actual product itself, which has its own dangers. But it's the synthetically derived ones that add to the problem. And they're being packaged in capsules, and they're in drinks, and being marketed heavily to children. And I think that is why we really need to act, even though, it probably will eventually be acted upon by the state and by the federal level. But right now, they have not done, it's a slower process, perhaps. It's being talked about at the CDC level, at the state level, but I think, once you know about it, it's really hard to say, oh yeah, we'll just wait. So I really feel like we need to move forward.
I agree. I think taking action is prudent. So I talked to Chris about what the game plan can be for that. I think we have the draft. I have had a chance to look over it briefly. I'd like to look it over more deeply with a fine-tooth comb, kind of make sure that everything is applicable from Canton to Abington. And then I think Northampton is the one that had all the things on it. Thank you for correcting me.
That's this one.
And I think we move
Thanks.
forward and tweak the draft. In the meantime, we can send a letter out to the establishments that are selling to let them know, hey, this is what we're looking at, this is what we're moving forward with. Set a date for the public hearing, probably for a week or two, like
Mid-May.
Mid-May. Let's get the other things off the agenda and then crank in on this. And that way it gives them time to kind of organize as well, do the public hearing, have them come in, voice their thoughts, and then in the meantime, it gives us an opportunity to do some additional research and then fine tune the draft.
Okay. I think a big part of the draft is fine as it is, but we'd want to make sure that we have a really clear sense of how we would enforce and, what kind of fines and how, it would be inspected. We need some more practical implementation of the regulation as well.
Especially given that our health agent
Yeah,
will no longer be with us. Sobbing.
Right, you guys will be doing a lot of visits to tobacco retailers.
Yeah.
So just to recap what you said, Chris is going to send a draft out to the
No.
A letter notifying.
Oh, just a letter.
Yeah.
Okay.
I don't want to send the draft out because
Right.
it's a draft.
Right.
Let's keep drafts not circulated.
In the draft folder.
Yeah, in the draft folder.
Yeah.
Yeah.
Let's do that.
a letter to let them know that this is coming.
Yeah, we don't want to have made public a draft that's not for official use and not for public consumption until we are like pretty much
Prepared.
agreed
Yeah.
and then can have our public hearing. And I think that would be a good strategy.
Okay, so perhaps we all take the Northampton drafts home with us, review them, make notes on them, and then we can prepare to review the notes at our next meeting. So we'll keep it on the
Thanks.
agenda.
Is it-
And in the meantime,
so-
Chris, would you mind starting the process of distributing the letters?
Yep.
So do we want to pick the meeting now? Because we need to notify Chris when, if it will be, because we can put that in part of the letter in one fell swoop.
Well, our next meeting is probably going to be April 29th, so that,
so not that
after the
one.
election, right? So
Yep.
2 weeks from that?
29th or the 13th it would be.
Do you guys do the schedule for the meetings?
No, we're just trying to plan ahead so that we
Okay.
can put it in the, are you available on that day?
I don't know. I don't know what day it is. I need a calendar, but that's
It
all
would
right.
still be a Wednesday, so it would.
Oh, okay.
For the moment,
Yes, that's-
we'll
yeah.
regroup when Jason
Yeah, after the election, we'll be doing a kind of a
restructure.
a regroup.
Okay, yeah, because I
Yeah.
miss the calendar.
I think
I
it
really
would be-
rely on it.
Me too. Let's
bring
make
it
that
with
a
you.
point to do it going
Yeah.
forward. But, so 29th will be our next meeting. We're not gonna do it then. I would like additional time. 2 weeks from the 29th brings us to Wednesday, May 13th.
Right, especially because I don't always get the emails. I got when you replied. But, yeah, so if I don't show up, it might be that I don't know.
So we could tentatively say May 13th, right?
Yeah,
Oh, I think I
For
got
a
a
public hearing or
confusing
for?
for the
yeah.
public hearing.
Okay.
Do we
Oh,
wanna
yeah, because
have-
you're gonna meet, never mind.
Yeah,
I answered my
on
own
the
question.
29th. Okay.
Oh, write that down so you can check it.
You know what, I know in my head I got something that day.
You do?
Yeah, that's all right. You guys can go on without me.
Okay.
Could I just ask one question about it?
Yeah.
I really understood what you were saying between the Canton one and this one, including more. Was there any discussion that makes it challenging to inspect for with all these other items that they have to
I'm
look
sure.
for?
Good question, it does indeed. But it's even hard to find the word kratom, because the folks who make the synthetic concentrated cannabinoids have great names for them. So, you know, in the fine print on these small packages, like Chris could probably speak to, like, how do you figure out that there's this substance in this drink that's, you know, in a really cool looking package with a flavor like, you
It
know,
would be
cherry
complicated
soda.
on
You know,
purpose.
and yeah, so it is complicated. Any thoughts on that, Chris?
As far as inspections?
Yeah, I mean, if it's a product and it's an energy boosting product, chances are it's one of those things. I know at least one of our retailers contacted me asking about omega-15, which is a synthetic opioid. I told him it wasn't banned now, but that it would behoove him not to start selling it because it probably will be banned
Right.
in short order, and they were fine with that. I was glad they called and checked. You know.
Yeah, that's lovely. Who was it?
It was Route 18 Superstore.
Nice job, Route
Yeah.
18 Superstore.
Yeah, it's going to be a little tricky because the names change and the new products come along, and that's why we wanted to include unregulated novel intoxicants and how we determine, you know, which are the products that are and aren't. And,
So
you know,
I just didn't know if there was like a limited number of hours that the inspector, it's a state or who inspects?
So it would be local. One of the reasons why it would behoove the town to have a full-time health agent is because there's constant training and seminars. They update at least 3 times a year, and there's ones that focus on these things because the names and the products change so frequently. It's, you know, you guys shouldn't have to be doing that on
We
your,
don't have
on your
time.
time when you have jobs.
No.
You pay somebody to do that. So that's how you stay on top of it. And, you know, most of the professional organizations that I belong to keep us updated as much as possible. So information's out there. It's just having a place for it to go.
The involvement of a health agent is crucial to the implementation of this, certainly. So let's keep it on the agenda for next meeting. Do we want to do any deep dive now, or would everybody like more time to kind of read it on their own before we start tweaking? Like, one of the things that comes to the forefront is like the fines. Like, I know the Canton ones were more than the North Andover, correct? So I don't want to do anything crazy, but I think second offenses should be increased. So maybe just look at those and kind of think about your comfort level.
yeah, when you look at Canton, I mean, their first offense was $1,000. Whereas Northampton was, the first offense was $300. But I agree that if they continue to sell the products, the second offense should be
More That's what I was
But that, it is kind of the same amount of money, but then it adds in suspensions.
I want a
and-
bigger fine for a second. If you're not willing to implement
Yeah.
changes, you need a
Do you see that?
reminder.
I think I do.
Yeah, it's right there.
Although just to
Yep,
consider,
that's the
like,
same thing.
looking at the wording here. So for second offense, a $300 fine and 3-day suspension of all Board of Health permits. So if you have a 21 plus tobacco shop, they just have a tobacco permit, that's it. But if you get a gas station, that's a suspension of their food permit as well.
Oh.
Then that's mandated here, that's not optional.
So it would be better to have it say second offense, $300 fine or whatever, and a 3-day suspension of tobacco permit?
Well, so what it's saying in this is that all permits, so I'm saying, like, that is gonna cost them a lot more than $1,000.
Oh, okay.
3-day suspension of their food and their tobacco permit.
can't sell a candy bar
Like,
either.
that convenience store is shut down. They're out of
Yeah,
business
right.
for 3 days.
So that is a pretty hefty fee.
That's too much. No, I think,
Because, and then the
leave it
third
at
offense is a
300.
30-day suspension, so that's putting a business out of business for 30
Yeah.
days. So just
so the
to be mindful.
suspension in general. Well,
I
I
mean-
think a suspension
That's probably why-
of tobacco license makes sense, like, hey, but maybe not even on, maybe on
It's not
third
all
offense.
tobacco, though, it's edibles, I mean,
Yeah,
Drinks
these are
and
being sold as drinks as well as, you know, and they're
supplements.
supplements and, yeah.
All right, so
Maybe
we'll
just
look at
leave,
that.
that's probably why Northampton left it at, not increasing it, they left it at 300, knowing they were gonna have hardships.
With the other suspensions, yeah. So, I don't know, I think that would be the deterrent. Not the
That's the bigger
$300, but
deterrent,
the,
yeah.
but the suspensions.
Yeah, that's got teeth.
It's hardcore. Okay, so we'll look at that. Any other commentary before we move on?
Yeah, no, I just feel like, you know, we have an opportunity to educate the public also a little bit about its dangers, and, you know, I'm putting together a fact sheet about kratom, but I'm going to add to it some of these other things that pop up that are not sold as kratom, but are as, if not more dangerous to adults, and really bad for kids. And the absolute flagrant marketing to children is reminiscent of early days of vaping with flavors like bubblegum and, you know, cherry soda and so on. So, yeah, it's a month ago, we didn't know what kratom was, and now we do.
I love the idea of putting out some teaching. If Carol, if you spearhead the fact sheet, Chris, would you be able to distribute it on social media and just kind of do some public awareness?
Yeah, and I can schedule posts on Facebook for up to 4 weeks in advance.
Oh, wow.
So if there's a campaign you want to do prior to me leaving, we can set that up.
Set that up.
Yeah.
Great, thank you, Chris.
The other thing I want to mention, just looking at, Carol, at your timeline, there's a question about whether or not you want to run this through legal counsel, town council.
The draft, yes.
Yeah, because you would want to do, if you decide that that's what you want to do, you're going to want to do it before your public hearing.
So let's bump
I
it back
didn't
2
think that,
more
no.
weeks. That's a really
Right,
valid
or-
point.
Do you want to run it through town council?
Are we decided on having to? Because both Canton and Northampton have run theirs through their town council. We have a severability clause, and given past experience, we tend to run into a lot of roadblocks and with the time it takes and the input we get, the value added is very minimal.
I still feel strongly about pushing it through. I want to have time for us to look at it again before we submit the draft with our own revisions. I do understand that some of the feedback has not been helpful. In fact, it's caused us additional strain and workload. But I'm not a lawyer, and I would rather give them the opportunity to see if maybe there is anything that we missed.
What's the process? How does this get to them and get it back to us in a timely fashion?
Well, that's a good question.
I would email it to
Maybe
town
Chris.
council tomorrow.
Tomorrow.
Yeah, well,
Do you have that email information?
Yeah,
Oh.
yeah, because I
okay. So
sent the
you're-
last ones.
So you're going to do that?
Yeah, I can do that
Okay.
if that is the desire of the board.
So,
I can,
Can we maybe make a comment in the email that this has been approved by Northampton's legal counsel, and maybe they won't change as much as they did last, for one of our last drafts?
You could wish.
the ability to speak freely. So the law firm that we use for town council is town council for most municipalities in Massachusetts, so their lawyers have probably already looked at it, but I can pretty much tell you what's gonna be added to it. Your fine structure is gonna be changed, the enforcement structure is gonna be changed. It's boilerplate for every set of regulations that we've ever sent to town council.
Okay.
So, many in public health will tell you there's no need to send it to town council. Again, the severability clause says that if something in there is unconstitutional or unlawful, it's struck without striking the entirety of the regulations. I can tell you, but when researching regulations in other towns, it's obvious by the way they're written that a lot of towns aren't getting, going through. It's best practice, but up to the board.
I'd like to maintain best practice.
So we'll, how do we get a date that we can guarantee that it's back to us so that we can work from it?
I am comfortable telling town council that you were holding a public hearing on the was it the 13th?
May 13th.
And that any feedback would need to be in prior to that.
Yeah, I would want it by our next meeting,
The
so
29th.
that when we go
I
to do
agree.
revisions, we can have that, and that way we're looking at it, and I feel like let's just make that like the major agenda item and try to keep everything else long so that we can dedicate a bunch of time to really go in segment by segment and say, this is what we have found that we want to do, this is what they did, and that way we're doing it all in one kabam.
And consolidate it
Yes.
before public
Yes.
hearing.
Yeah.
Yeah, that sounds good.
Okay. Awesome. Thank you. Anything else? All right. So our next action item is the discussion regarding the proposed rules and regulations governing horses and stables. I feel like,
Do we even have?
no, we don't have anything printed out for that.
I think last time, I recall that we said we would wait until after the town vote for right to farm,
For that one.
because it may affect the horse stable more than any other regulations that we have. So that one
Okay.
in particular.
Also, I almost
So we're
wish we
gonna just-
didn't even have it on the agenda. We're just gonna bypass that one.
Right, so shall we bypass it?
Yep,
Okay.
we're gonna bypass it.
I did get a copy of that. I wanted to get another copy. I gave my copy to Joe that night so that he could
Okay.
answer the questions, you know what I mean?
Uh-huh.
Right then, like he did.
Yes.
But,
Are you talking about the stable or the livestock?
I think I don't know. One
We're
of them.
doing stable,
Yeah, I think whatever copy we got last week, I gave it
handed
to
on.
him, and I
We can make sure you
Yeah.
get another one.
can't, if you don't mind.
Yeah.
Yeah. Because
Paper
it seems
copy or
like,
email?
I could take it to email.
Okay, perfect.
Yeah.
I will forward
Okay.
that.
I appreciate that so much, thanks.
Yeah, no sweat. All right, so we're gonna bypass 4 and move on to 5 then, which is the discussion regarding the proposed regulation for the registration of livestock under the new name, which I feel excited about. I'm feeling really good about where we're at with this revised model. Carol, thank you so much for going in and doing the cleanup and adjusting the registration form. I'm loving the look of it. It sounds like all the feedback that we've gotten has been positive at this point in time. I think that we move to, it's not on the agenda for tonight, so we can't vote on it, but I think we put it back on the agenda for next time and we make it so we can vote.
Yeah, I just want to say thank you to anybody who participated in the public hearing or individual emails or text messages that, or Joe, who came to several meetings. We've gotten lots and lots of good information, and so that has really shaped our shift from our previous, not our previous, the form that people thought was our previous one. So now we're talking about a final regulation to establish a registry of livestock in Abington. And just to remind everybody, once again, mainly it's based as a way to reach registrants in the event of some type of emergency that involves humans, animal health in our community. And that's as simple as it can get. And so I would encourage anybody who has livestock to reach out to us in the next few weeks when we have a form available, registration form, just so that we are aware when there's animals that have rabies, or there's an increase in bird flu, or there's some other emergency that comes up that people would want to be informed. And I just also want to say sorry for any misperceptions caused by the public release of an internal document in the past that we didn't approve, and that kind of changed the process extensively. And so we're back on track to what our original plan was.
I'm happy where we ended up, and we ended up getting a lot of good information, so.
Yeah, and
You know
it's
what?
great to know.
We went over the mountain, and it ended up getting us
Yeah.
to the pretty view.
So also in our packets, I've done up a mock draft form that just kind of talks about what kind of information. It's very straightforward. I did a sample, just like, okay, let me just tell you what we have. We have chickens, and they're all hens. We have a goat. Simple. And those will be available for people who want to join this registry in light of public health and safety. That's all I have to
Those
say.
are beautiful. It makes it really clear and straightforward. Thank you.
Yep.
Perfect. Any other thoughts or comments?
Yeah, I don't know if I got to be the final one, but I think it looks like what we discussed. The simple sketch got simplified, so that's good.
Yeah. We don't want it to be burdensome.
It's even simpler than simple. Yeah, and there's no cost.
Great.
Hopefully, we'll have another health agent to help implement this process.
Right. We'll figure something out in the meantime. Right. So there was that.
Okay, I'm gonna move on. So I'll put that back on the agenda for next meeting with the vote. And then our next item is approval and request for additional garbage and recyclable containers pursuant to the rules and regulations of combined rubbish, garbage, and recyclables collections,
Easy.
which we have none.
Done today?
Okay.
No, so no one's called in about getting any extra barrels or anything?
No, thankfully, we've done some repairs the last week. I only have about a dozen barrels left. I have held off ordering them because, as you guys know, because you did not approve of, the trash contract is currently out for bid.
Oh, right, why would we get more if we're not gonna have the same trash
I'm not
company?
comfortable spending $15,000 on barrels when we may or may not continue with what we can. I mean, depending on who the contract is, we could very well continue to use the barrels that we have currently, but some companies have their own, or they have a different process of picking them up and might want to switch, so.
Do you have any insider information on how long that process is gonna take?
There's a timeline. I will be involved with part of it. I think questions have to be in by the 17th. There's a couple of deadlines. I don't know off the top of my head, but the bid is supposed to be awarded like May 17th. I know Republic has expressed interest, Boston Karting has expressed interest, and I think Allstate just asked for a copy of the RFP.
Boston Karting is our current.
Is our current, yes. Star Waste Management, Morning Song, they get a bunch of different names.
Sad because you had a good relationship with them too.
I would just say for the record, both our drivers were out sick. Actually, one had a death in the family and one was out sick Monday and Tuesday. Our trash driver called me from his cell phone in his sickbed to help clear up some misunderstandings we were having with the substitute driver. So that's the level of service that we're currently getting from Boston Karting, personal cell phone calls.
Did you voice that to our town manager and let him know how good they are?
Mm-hmm.
Good. I hope that he puts that into his decision-making process.
If I'm not mistaken, have we had the same drivers like for a very long time? Like they were with another company and now they're with the company?
Yeah, they were actually with Republic and left them over the strike.
Yeah.
and went to work for Boston Karting and
And then-
continued with us.
Yeah.
If we lose Boston Karting, we'll lose our drivers.
Yeah, they've been a main driver in that, and yeah, they were very helpful.
Yeah. Dave and
Through
Mike,
the
for the
strike.
record, Dave's our trash driver, Mike's our recycling driver. Two top-notch guys.
You pass on those cell phone numbers, like, because we don't have a Rico anymore either.
Yeah, that would be up to, I would ask the drivers. We use Slack app to communicate with them.
Okay,
On a
yeah.
daily basis,
So
so,
that there's some,
yeah, you guys could certainly sign up for Slack and harass the drivers all you want.
yeah,
on Slack.
so that there's some method of
Yeah.
communication and continuity, is what
Yeah.
I mean to say, yeah.
Thank you. Any other questions about that? No, I think no. So we'll move on to correspondence. Does anybody have any correspondence to share? I do not. Not this week.
Nope.
Beautiful. In that case, I will take a motion to adjourn the meeting.
Motion to adjourn?
Thank you, Lisa.
I'll second.
Thank you, Sue. All in favor?
Aye.
Thank you. We're adjourned.
Thank you.